You're welcome to another episode of Fertility Talk with Olarunke Thaddeus. How are you doing? On today's episode, I will be discussing why IVF might be an option for you. Okay, so what is IVF? Yes, I still get this question, and when I get it, it bothers me. Like, a lot of women still do not know that there is something called IVF, and this fertility option has been saving lives, has been helping our women get pregnant. Okay, so let's talk about what IVF is and why it might be an option for you. IVF means in vitro fertilization. Okay, it's a fertilization that takes place outside the woman's body. You know, the normal pregnancy, the natural one, when you have sex with your husband, you know, you get pregnant. But in the case of IVF, you will be stimulated, your ovaries will be stimulated, and your eggs will be retrieved outside your body, and your partner also will produce a sperm, and both your eggs and the sperm will be fertilized in the IVF lab. Wait for 5 days to grow into what is called blastocyst, after which the embryos will now be transferred back into your womb for fertilization or for implantation to take place. Okay, so after the embryos are transferred into your womb, then there is a waiting of 2 weeks, and during this waiting period, all you need to do is to just chill and hope for the best. And by 2 weeks, after 2 weeks, then you do your pregnancy tests and you're pregnant, or God forbid, it might go the other way around. Truly, IVF process is not 100%, okay, but so many times there is this misconception I've been seeing going on around that more like is a 50-50 thing, like you know, the chances are very, very slim. You know, I just want to tell you that your chances could be as high as 90% or 95%, and the other person's chances could just be 40-50%. So individual chances really varies from one another. So what I'm trying to say in essence is that you cannot use somebody else's situation to judge your own situation, or you cannot say, oh, because my friend did IVF 2-3 times and she didn't get pregnant, then because of it you're not even going to try it at all. I have seen a lot of couples that did IVF one time, just one time, in fact a lot of time, just one time, and it clicks for them. What stops that scenario from happening to you? But because you've already preconditioned your mind towards the negative narrative about IVF, then you know you're not opening your heart to it. So I'm talking to you today that IVF might be an option for you if you've been having intercourse repeatedly. You know you've been having intercourse, you know that you have done your best in that part, because we have some couples that they will not have sex regularly. Okay, maybe you're just having sex once in a week. You know yourself that that's not enough for you to get pregnant. Okay, so you need to be having sex, say 3-4 times in a week. If you're trying to make babies, and if you're trying to have babies, you need to increase the numbers of time you have sex. Okay, so when you have done this repeatedly for 6 months or 1 year, please, you go to the hospital and check what is wrong. Okay, so when you check what is wrong, if you are still young, yeah, you could opt for IUI. That is another procedure. But what stops you from directly going for IVF? Because IVF chances is more higher than IUI. IUI means intrauterine insemination, but you know IVF chances is far better. So you go for IVF once and for all. You're still young, your eggs are still very viable, so you go for it, and you know, I pray it will work for you. It's been working for a lot of my women, like I've said earlier on. So all you need to do is just, you know, send me a DM or you call the numbers on your screen, do you understand? Then we get started. So if you know you've been waiting for quite a number of years and you've not tried IVF, please, you need to try IVF. Okay. Also, some women, they've actually gone further to actually evaluate themselves and see what the problem is. They've visited one hospital or the other and they've been diagnosed with tuber blockage. Okay, if this is you, then you need IVF. You need IVF. If this is you, stop all that herbs you're taking, stop all that stuff you're doing, and just save towards it and come for it, because IVF is one procedure that bypasses the tubes. It bypasses the fallopian tubes straight into your womb. Embryos are dropped straight into your womb. So you need this procedure that will bypass the already affected tubes into your womb so that you can get pregnant. Okay, so if this is you, yes, truly you need IVF. Okay, also you need IVF if your partner's sperm, if there is a low sperm count. If there is a low sperm count, you need IVF. With IVF, using ICSI method, that is intracytoplasmic sperm injection, the sperm cell can be picked, the best of the sperm cell can be picked, and this would really help you to achieve pregnancy. Okay, and with this with this method, even male with motility issue can also, their sperm can perform that function of fertilizing the eggs with the help of ICSI. So if your man has sperm related issues, then this is a very good reason why you should consider IVF. Okay, so you should also consider IVF if you know you're above 39 years old and you're still looking for fruits of the womb, you're above 39 years old, please, you need to consider IVF. Okay, the truth about us as a woman is that as we grow old, our eggs also ages with us. Okay, thereby making getting pregnant naturally a bit more difficult. Okay, so IVF is what you can consider once you're above 39 years of age. Okay, so you can consider IVF. Okay, so you can also consider IVF if you have issues with your eggs. Okay, like I said earlier on, with age comes age affects the egg, and so you've reached menopause. Definitely there are no eggs again, you're not menstruating again. So IVF is one process that would help you. During the course of IVF, there is management course where the doctor would help you bring back your period, and a donor egg cycle can be done for you, and you'll be able to carry your pregnancy. So truly you need IVF if you've reached menopause and you're still waiting for fruits of the womb. Okay, so stop all the waiting, go for it. All you need to do is to go for it. These are just few reasons I could think of why you should go for IVF. Okay, heading to another subtopic, why IVF fails. Why a lot of women exercise fear concerning IVF. They've not even tried it. They will say, oh, they heard IVF is 50-50, it fails, all that. Why IVF fails. Okay, IVF can fail if your womb is not in good shape. It can fail if there is fibroid occupying your womb. Okay, so before you do your IVF, if you know you have fibroids, please, you can talk to us. We'll take care of the fibroid for you, and then you can try IVF after you've properly taken care of your IVF. So you start IVF. Before you start it, we need to comprehensively evaluate you. Okay? If the womb has issues, chances are that the IVF might not work. Okay, so another reason why IVF might not work is if you are above 40 years old and you want to try using your eggs. Okay, why I am saying this is because age is a very important, or age plays a very important role in IVF. Okay, the more younger you are, the more higher your chances of pregnancy. Okay, so you might want to reconsider using donor egg option once you're above 40 years old. Okay, another reason why IVF also fails is if the embryos are not dropped correctly. Maybe the doctor did not drop it where he is supposed to drop, or she is supposed to drop the embryos. So this is why you need an expert. Use an IVF hospital that has a very good track record. You can leave that part to us. We'll help you choose which one is good for you. Okay, yeah, so all you need to do is to send us a DM. Let's do what we can do for you to help you increase your IVF chances. Okay, yeah, another reason why IVF might fail is if quality drugs are not used during the process to stimulate you. Some drugs works better than the other, so this still boils down to why you need to use a very good hand when you're doing your IVF. Okay, so you need a good hand that knows when to put in those embryo into you. The measurement of your lining has to be checked. It has to be in order before the embryos are dropped into your womb. Okay, so you need a good hand generally before you embark on your IVF. Okay, another reason why IVF also fails is if the sperm is bad. Yeah, truly some sperm could be bad even with ICSI, especially when it borders on morphology issues. When you have a bad sperm, then just like when there is a bad egg, there is a donor sperm. There's sperm donors all around. We source for sperm donor, we source for egg donors. So you could consider sperm donor if the sperm is the issue. Okay, and you don't need to feel shy. If your wife could accept to use donor egg, there's no reason why you as a guy also shouldn't accept to use donor sperm if truly your sperm has issues. But trust me, we are Nigerians, and before any doctor will give up on your sperm, man, they would have done everything humanly possible. So you don't have anything to actually worry about as a guy. Okay, they said it's man's word, truly. But I know a lot of doctors, before they will pronounce that verdict of donor sperm on any guy, it takes a while. I have seen this often, repeatedly. But for women, they will just go straight and say, "Oh, my lady, please, let's consider using a donor egg." And you don't really have a choice. They explain to you, with your age, it affects the quality of the egg. You don't want to have baby that has medical conditions. You don't want to have baby that has abnormalities and all that. And but as couples, when we are tackling infertility, we need to work together. You need to work together with your partner. Both of you must be ready to accept the verdict. That is what I want to say. You must be ready to accept the verdict. If the problem is coming from the male should please be ready to accept the verdict. If the problem is coming from the female should accept the verdict. Please don't be a stumbling block to each other's dream. Both of you can make this thing work. But since both of you are working together to achieve the same goal, which is the priority, then you should be able to adjust, make amendments, shift for each other, and make room for partnership that would turn out to be what we're looking for at the end of the day. Okay, so thank you for watching today's episode of Fertility Talk with Olarunke Thaddeus. I hope you've learned something. Okay, so for more enquiries, please send us a DM. For consultation, kindly call the number showing on your screen, and don't forget to subscribe to our YouTube channel and follow us on Instagram at Meet Surrogate Mother. Thank you and God bless. Looking forward to seeing you next time.